All right, so continuing with this lightning round of presentations, I hope not to swamp you. So AnaVu for clinical planning. A quick genesis about this. I know there's a lot to take in one slide. I'll just summarize it real fast for you. So at the very beginning, AnaVu, or Anatomy Viewer, was viewed as a tool to be used in the classroom. So they take MRI scans and do a 3D rendering of the internal organs, and specifically the brain. And it creates this multi-layered drawing, 3D drawing, which then the teacher can use, break down into different layers and then guide the students through it. It has been rather well received through some of the medical hospitals, the medical colleges. So now we've been getting some feedback from some hospitals, so it's showing some interest. There's this video, I'll just spare you the agony of going through it. I'll just go straight to the last slide. Oops, if I can. All right. So there has been some interest from some hospitals. We got some feedback of using AnaVu for clinical assistance. So specifically, this one use case, what I'd like to walk you through, radiotherapy planning. So for a patient with a brain tumor, they are quite interested in a 3D visualization of the normal parts of the brain. Ideally, the 3D visualization of the actual tumor itself. But at the very least, what we are looking to do is leverage the existing AnaVu stack to do a 3D rendering of the normal parts of the brain. So we start with taking the MRI of the patient and then do some auto-annotation of the brain parts. So that is the part where we'll be using some ML. We're getting a lot of data from our partner hospitals to build, to give us the training data set on which we build the auto-annotation piece. Once we have the auto-annotation in place, then we will do a 3D rendering of the normal parts of the brain. That in turn allows the doctor to do the right contouring of the tumor and do a much more precise radiotherapy. And once we get success in this particular use case, we can expand to other use cases, again, pertaining to therapy. The impact is clearly ease of contouring the brain tumor, much better, much more precise therapy. And also on the annotation side, right now, at least for radiotherapy, they take at least 3 hours, if not longer, you know better, to annotate the MRI. So bring it down to a few minutes, and it can have a multiplicative effect over multiple scans. As far as the market opportunity is concerned, right now, from the feedback that we have received, we haven't identified any India-based medical imaging tools that does this. And it can fill a really big gap, not only in oncology, but in a whole bunch of other therapy treatments in India. All right.